It is important to be prepared in case your client has a medical emergency. Make sure that emergency information is posted by the telephone. The list should include the proper emergency number in your area. In most areas, that number is 911. The physician's name and phone number, pharmacy number, the number of a relative or neighbor, the house address, and the name and number of your agency supervisor. Always follow your agency's policy for handling emergencies. One emergency that requires immediate attention is a heart attack. Be aware of the signs and symptoms of a heart attack. They include chest pain, pain that radiates within the shoulder, neck, or arms, dizziness, sweating, nausea, and difficulty breathing. Remember that a woman's symptoms are less predictable, and she may not experience chest pain. However, she will often have shortness of breath, nausea, and vomiting. If you suspect that your client is having a heart attack, call for emergency medical assistance immediately. Become familiar with the signs and symptoms of a stroke that include weakness or paralysis on one side of the body, facial drooping, and slurred or incoherent speech. If you suspect that your client has had a stroke, call for emergency assistance immediately. Falls are the leading cause of death from injury for people 65 years or older. The most common injury from falls is a hip fracture. Falling may be a sign of a serious medical condition. Follow your agency's procedure for handling falls. Important information to report and record about falls includes the day, time, and location of the fall, how the fall occurred, any history of previous falls. If your client is unconscious after a fall, call 911 or your local emergency number. Do not move the person because he could have a neck or spinal cord injury, and moving him could make it worse. Cover him with a blanket to prevent chilling. Notify your supervisor. Stay with your client until help is available. It is important to know whether your client has a DNR order. DNR stands for Do Not Resuscitate. It is a doctor's order that resuscitation should not be attempted if the person's heart or breathing stops. A DNR order means that the person does not wish to be brought back to life if his or her breathing or heart stops. Even with a DNR, you should still call emergency services if your client stops breathing. They will determine the proper medical procedure. If your client has a DNR order, it should be visible and easy for you, other care providers, and emergency personnel to locate. Older people are more vulnerable to fires and natural disasters because of reduced mobility, hearing, or other impairments. It is estimated that 75% of older people who die in home fires did not have working smoke alarms. Working smoke alarms provide early warning of fire and are especially important for older people. A safety checklist of the client's home should include monthly testing of the smoke alarms. In an emergency, follow your agency's plan for moving your client to safety or for another staff member to replace you. If you cannot contact the agency because of power outage or problems, listen to a battery-operated radio for emergency information. Stay with your client until help arrives or until your client has been moved to a shelter where he or she is physically stable and secure. Leaving your client in an unsafe situation during an emergency is considered abandonment or desertion. Don't leave a confused client alone at an emergency shelter. He or she will continue to need one-on-one care. When caring for someone on bed rest, the wrap and slide technique is a safe way to move that person out of danger. Use a blanket or sheet to wrap the person's body. Support their head and shoulders as you gently slide them off the bed in the direction of the exit. Wipe up blood spills immediately using disposable cleaning cloths. Small spills can be cleaned with paper towels and a bleach water solution. The standard bleach solution is 1 cup bleach to 2.5 quarts of water. For larger spills, a blood spill kit that contains gloves, absorbent powder, disinfectant cloths, and biohazard bags can be used. Follow the directions on the kit. After the spill is absorbed, use the cards provided in the kit to gather up the material. Then use the disinfectant cloth to clean the area. Use additional wipes if needed. Then dry the area. Dispose of gloves and all cleaning materials in the biohazard bag provided and seal securely. Then wash your hands. Understanding how to respond to emergencies is an important responsibility for care providers. When you respond promptly and calmly, following your agency's emergency guidelines, you protect your client's safety as well as your own.